because our patients are there and the caregivers are there focused on delivering the best service possible.
It's still a business about people. It's a business of taking care of people. And so what brings most of us together is that interest.
When you join LHP, you're not that standalone hospital anymore. You're part of a network, and you're part of a family.
We started from a dead stop. We didn't have any hospitals when we started the company. We had an idea, we had the concept of a joint venture, and we had the experience of having done this before. And we've grown to a company of substantial size in a short period of time. And I'm very proud of the accomplishments of the management team and of the caregivers in the hospital and the care they deliver.
It feels like just yesterday when there was a group of us sitting around Dan Moen's dining room table and his wife was fixing us lunch and we were working on the business plan.
One of the things that was different about founding LHP was the way we went about gathering our stakeholders, and in particular the way we built our board. Our board is the NBA all-star team of hospital company boards. We have an array of thought leaders from the hospital industry that's really unmatched in terms of their service in not-for-profit health care. And these are folks that help us speak the language of the not-for-profit systems that we're hoping to partner with.
We believe that culture is king, and that at the end of the day, culture actually trumps strategy.
We started with a team of people that agreed on what the company culture was going to be and agreed on what those core commitments about culture were going to be. We're all about taking care of the patient first. We make sure that we hammer home that culture message.
I think what's different about LHP and the culture is that it isn't just talk. It's demonstrated in everything that they do. Oftentimes it's surprising for the chief nursing officer at the hospital to know that there's someone there to help advocate for nursing, to elevate that position if it isn't already part of the senior leadership team.
We spend a lot of time up front with our potential partners understanding one another's cultural sensitivities and making sure that we have a compatible culture.
Our joint venture model has a governance structure that's really unique in the industry because it incorporates concepts of collaboration right in the legal structure.
We're all about physician participation and decision making, and we're about collaboration with our local partners and all of our stakeholders.
We have town hall meetings every quarter, so we don't just talk about compliance, once a year. We talk about it at least every quarter, and usually more than that. We feel like that the compliance program is the soul of our company.
Employees in today's marketplace are looking for opportunities where they can participate in an organization that is collaborative, one that treats them with respect and dignity, allows them to have some balance. The environment that you create, opportunities that you provide to them in the way of challenging work assignments are things that contribute to making your company a very attractive place to work.
We involve our physicians with every major decision. We openly discuss everything with them. To do that, we extensively use our physician roundtable. It's an informal group there at the hospital. The physicians come to participate at will, and we talk about anything that they want to talk about.
So as a medical staff, I would like to thank LHP, the Portland Healthcare Foundation, and all those who've made this dream a reality, and also for allowing physicians to have a seat at the table through the physician roundtable, through the board of trustees, and through all the things that they do that give us a voice and make us a vital part of this. So I thank you for that.
LHP's philosophy is one that's very inclusive. Nursing has a very important seat at the table, and as the person closest to the patient, it's most important that they have a role or a say in how things are done in caring for the patient.
The doctors, our nurses, our managers in the field, all of them are involved in their aspects of it. And really our role is trying to aggregate that data. What's coming in from our nurse leaders, our physician leaders, our practice managers, and trying to aggregate that data and then share it back.
Collaboration goes beyond the physicians and the nurses. It goes to the people that you interface, your software vendors, your services vendors, your business office vendors. All have to be a part of understanding what expectations are and working with you collaboratively to get the outcomes that you want.
And our commitment to this community is to provide the best health care in this area and to do it jointly and collaboratively with the healthcare providers all the way up and down the line.
Having great quality and great finances are not mutually exclusive. You can do it all. You can have great quality, you can have high satisfaction, you can have high physician satisfaction, you can have great financial outcomes too.
It's time to have a beautiful new facility and state-of-the-art equipment. It's very exciting, and orthopedic surgery is obviously a very high-tech specialty, and we'll have all the bells and whistles at our fingertips, and that's exciting from my standpoint.
We've actually financed the hospital with all equity, no debt. On time, in budget, 14 months. Amazing, amazing.
Most people get into healthcare because they want to help other people. And nothing's more fundamental than that at the local level, because that's where care is delivered. So I think those joint ventures keep you grounded. They keep you grounded in what it's about, and it's about taking care of local people.
You've got two types of organizations today. You've got independent organizations that want to remain independent but need to create scale on their own. And you've got networks that are trying to become larger. And so everybody's looking for scale in their own way. We've got a joint venture model where we bring capital to the table to facilitate those types of transactions that would create scale.
I get a chance to work with not only the administrative teams at the hospitals, but the physicians and people in the community, board members, and it's wonderful to go back there and have people say things like, LHP did everything they said they would do and more. That's really what we're all about, helping that hospital attain its vision of where it wants to go.
Ultimately, at the end of the day, it's about regionalizing healthcare and getting stronger. And I think LHP is in a strong position to help those communities meet those objectives.
LHP has been a superior partner. They've met every expectation, from building this facility to bringing in new management. They have not only met the letter of the contract we signed with them, they've met the spirit of the contract. I'm very impressed.
We're excited about being here. We're excited about the investment in this community. We look to grow with you as you continue to grow, and we want to be here for many years to come. And we thank you for that opportunity. Thank you.
From my point of view as the CEO of the company, I want to be known as a great operating company that focuses on service excellence and quality patient care.
This is not a business that should be about making money. It's a business about serving the healthcare needs of a community. And if we take care of patients and their families, then this will be a good business.
Providing health care is really a noble service, and it's fun, it's rewarding at the end of the day to know that you're doing something to take care of your neighbor, your friend, and that patient. We're doing something that can make a difference.